Lifting and transferring of patient. Introduction. Lifting is a technique by which the patient is moved gently and safely based on scientific principles. Definition. Transfer is defined as preparing patient, completing necessary records and shifting patient to another department within the hospital or another hospital. Or transfer referral are the preparation of patient and the referral records to shift the patient to other department within the hospital or another hospital. Gender principles. The first principle is position yourself. Correct foot position is essential to maintain balance. Second, lift with leg muscles. Leg muscles are much stronger than lower muscles. Lift with your legs. You can avoid strain on back muscles and lift more weight. Principle number 3. Talk your chin. The act of talking the chin may reduce the needs for spiral muscles to contract so there is less chance of muscle strain in the back. 4. Use rocking movements. Rocking on objects builds momentum which can aid the lifting process. Principle number 5. Hold the load close. If you hold the load as close to you as possible, you will cut on the streets in the extracted on your arms and back. Do not twist or bend. Moving your feet instead of your upper body can help balance the load and minimize the strain in your back and abdominal muscle. Purpose: to promote the task efficiently, to avoid patient from unnecessary effort. 3. To prevent nose from strain and back injuries. Point number 4. To promote comfort to the patient. Lifting criteria. First point, position of weight. The weight of the object to be lifted should be as close to the filter as possible. Position of the nurse, because the objects to be lifted in the same place as the nurse. Point number 2, height of the body. The best height for lifting an object vertically is slightly above the level of the middle finger of a person with the arm hanging at the side. Point number 3, maximum weight. Weight of the object should not be more than 35% of the nurse's body weight. For body weight position, it varies with different lifting tasks. General instruction. Plan the movement of the patient ahead of time and be sure the bath is clear. Flex the knees and hip joints but keep the tuck as vertical as possible. Assistance should be requested when lifting or moving heavy patient. The height of the bed should be adjusted before lifting or moving. The patient is moved to the edge of the bed before he is lifted from the bed, unless contraindicated. Encourage the patient to use his abilities as much as possible. Observe the patient for symptoms of orthostatic hypotension such as fainting, dizziness, sweating, etc. Nurse's responsibility in lifting and moving. Evaluate the situations. Explain to the patients exactly what you are going to do. Provide equipment, example bladder, which may help the patient assist in love. Adjust the stretcher, chair, it is to the bed level or vice versa, and lower and hand drill or side roll. Hold the patient close. This will help your balance strength on your arms and back. Keep your feet apart. This will provide a stable base. Use gentle rocking movements to assist the initial movement of the patient. When working with others, make sure everyone knows what to do in advance and move at the same time. Preliminary assessment. Check. Doctor orders for specific precautions. general condition and diagnosis of the patient, level of consciousness, self care ability, presence of tubes and lines, example intravenous IV, line, follow its catheter 86, mental stable to follow instruction, number of personnel required to move the patient safely, articles available in the patient's unit, example stethoscope, IV poles, clamps for disconnecting tubes, etc. Preparation of the patient and environment. Explain the sequence of the procedure. Provide privacy. Address bedpan urinal if needed. Arrange the article at the bedside. Remove all comfort devices used for the patient. Clamp the catheter to prevent backflow of urine during the transfer. Clamp the nasogastric tube and other tube if any. Place the footstool if needed. Encourage the patient as is possible. Some of the devices used for lifting and transferring of patient. Procedure. Moving the patient in bed to side. Wash hand and dry it. Place the bed in a flat position. Place the patient in supine position. The nurses place their arms on bed, sliding them under the patient head, shoulder, hips and leg. Wait for the leader signal by counting 1, 2, 3. When the leader counts 3, move the patient to the side of the bed using a right angle pull maneuver. Assisting the patient to sit on the side of the day. Wash hand and dry it. Place the patient in the supine position. Flex the knee gently, left leg only. Support one hand at the shoulder and move in the hip. Turn gently to the right of the patient. Assess the patient to side heels of the edge of the mattress. Then roll upward on an elbow till he or she reaches a single position. Assist the patient to place both arms extended backward with palms supporting on the mattress and both feet flat on floor to maintain sitting position. Shifting the patient from bed to stretcher. Position the stretcher at the right angle to head or foot of the bed. Cell helpers and position them at the beside. Move the patient to the edge of the bed. At the count of 1, the nurse side their arms under the patient to support the section of the patient. At the count of 2, the nurse stand with the back erect holding the patient near to their body as possible. On the count of 3, the nurses take one step backward and pivot on their heels toward the stretcher. At the count of 4, move the side to the stretcher and stand with a wide base and fixed knees ready to lower the patient into a stretcher. At the count of 5, the nurse lower the patient to the stretcher in a back-lying position. 3. Assisting the patient from bed to chair or wheelchair. Place the wheelchair or armchair at the right side of the bed. Wheel should be locked. Helps the patient to sit on the chair. Tell the patient to slide his buttocks to the edge of the bed by shifting his weight alternately from left to left buttocks till his feet placed on the floor in a forward backward wide based position. One foot placed at the back of the other slightly under the bed. Tell the patient to stand on command by simultaneously leaning forward, pushing with the foot placed at the back edge straightness his legs. The patient stands upright by balancing himself on the armchair, side rails, or mattress. Tell the patient to place his left arm on the palm arm of the chair or wheelchair and pivot on the heel of his feet and bring the buttocks toward the wheelchair. Point number 9. Observe for correct sitting posture. Reserve the procedure to return the patient from wheelchair to bed. Aftercare. Make sure that patient is in a correct alignment is comfortable. Replace the pillows and other confirm devices for devices are needed. The nurse will remain with the patient in front of him when the patient assumes a sitting or standing position. Tidy up the unit. Wash and thoroughly. Record the procedure in the nurse's record. Log rolling. Log rolling is a technique used to turn patient whose body must at all times be kept in a straight alignment like a log. The technique is used for the patient who has a spinal injury. Log rolling requires two people or if the patient is large, three people. Log rolling figure. Technique. Wash your hand. Approach and identify the patient by checking the identification band and explain. Provide privacy. Position of bed. Position yourself with your feet apart and your knees interclose to the side of the bed. Fold the patient arm across his chest. Place your arms under the patient so that a major portion of the patient weight is centered between your arms. The arm of one nurse should support the patient head and neck. On the count of three moves, the patient to the side of the bed, rocking backward on your heels and keeping the patient body in the correct alignment. Raise the side roll on that side of the bed. Move to other side of the bed. Next point. Place a pillow under the patient head and another between his legs. Position the patient near arm towards you. On the count of three, rolls the patient to a lateral position, rocking backward onto your heels. Transferring patient from bed to wheelchair. Purposes. Enhance the well-being of patient. To transfer to other department for investigations like X-ray, ultrasonography, electrophalography, etc. Improve self-image and ability to move around. Procedure. Explain the purpose of use of wheelchair. Access the patient's ability to move. Point number 3. Place the wheelchair at the right of the patient and lock it. 4. Raise the patient to the level of the wheelchair. 5. Elevate the head in of the bedside down the rails. 6. Provide privacy. Take assistance from males, females, other lines. Help the patient to stand in front of the wheelchair. Lift up foot rest and assist to sit on the chair. In case of chronic hemiplegic, one nurse stand behind the patient, slides hand under the axillary and holds the chest level. Other nurses orderly stand in the front of the patient, holds his legs and simultaneously lift the patient to the wheelchair by counting or 1, 2, 3. Some of the figure transferring from bed to wheelchair. Transfer from wheelchair to bed. Patients who are weak, very ill, and with fracture of legs are transferred from the outpatient department to the one by wheelchair. Procedure. Explain the technique of sliding from the wheelchair to the bed if the patient is able to move by himself. Keep the wheelchair with the mirror close to the bed and lock the wheelchair. Ask for the MNO or FNO assistance. One has to be at the backside and one in the front of the patient, lifting the patient knees and thigh off. Nurses should count 1 to 3, then both simultaneously lift the patient from the wheelchair onto middle of the bed. Slowly help the patient to lie down by giving support to the head and back and place the legs on bed. Place the patient in correct body alignment and make comfortable giving extra pillows. Some of the features: transporting a patient from wheelchair to bed. 45 degrees suitable for a patient to transition from wheelchair to bed. Transfer from bed to stretcher and stretcher to bed. Indication: patient with spinal injury, patient after surgery, patient with CBA and unconsciousness, patient with multiple injuries problem. Procedure: check the doctor's order. Keep the stretcher ready with unnecessary articles. Explain the procedure and purpose to the patient. Provide privacy. Loosen the draw seat on the both sides of the bed. If there is a roller, keep it under the back of the patient and roll into the stretcher on count 1 to 3. Taking care of the head, place the arms across his chest. If the roller is not available, middle portion, hold the draw, Macintosh, one hold the head, another hold the legs, and lift the patient from the bed to stretcher on count 1 to 3. Remove the roller side of the slide rolls of the stretcher. Cover the patient and fasten belts safely across the patient's chest and waist. Adjust head of the stretcher according to the patient condition. Place a pillow under the head and provide other comfortable measures. Unclog the wheels and move the stretcher to the specific purposes. Check the vital signs and observe for any complication. Record and report the procedure. Some of the figures: transfer from stretcher to bed or bed to stretchers. Conclusion: proper lifting technique. Preparing an individual for a move. Lifting and moving techniques. All in all, just remember to be asked for help when needed to the patient. Stay home, stay safe. Thank you. Thank you for your cooperation.